Welcome, everyone, to another episode of Vet NeuroJar, the podcast dedicated to all things veterinary neurology. I'm your host, and today we're diving deep into a topic that's crucial for anyone working with horses, the clinical examination of the muscle system. We're fortunate to have with us today a guest to guide us through this complex area. Let's start with the basics. Why is it so important for equine clinicians to really master the art of examining the muscle system in horses?
Well, it's vital for several reasons. Muscle disorders are actually quite common in horses, especially those involved in athletic activities. These issues can significantly impact a horse's performance and overall well-being. The challenge is that the signs of muscle problems can be subtle, sometimes even vague, and they can easily overlap with signs of other conditions, like orthopedic or even neurological disorders.
That makes sense. So, it's like being a detective, piecing together clues to get to the real issue.
Exactly. A thorough and methodical examination is really the first and most critical step in figuring out what's going on. It helps us create a list of possible causes and guides us in choosing the right diagnostic tests. Plus, diagnostic procedures can be costly and might require the horse to rest, so we want to make sure we're targeting the right areas.
So, where do you even begin when you're faced with a horse that might have a muscle issue?
The very first thing is taking a really good history. It's something that unfolds in stages. You start gathering information even before you see the horse. Keep digging during the appointment, and don't be afraid to follow up with more questions later if you need to.
So, it's not just a quick chat with the owner. What kind of information are you trying to get at this stage?
You're trying to understand the primary concerns of the owner, and if there were any specific events that might have triggered the problem, especially exercise. You need to determine if it's truly a medical issue, or if it might be related to the horse's behavior, how it's managed, or even the tack being used. Most importantly, try to understand if the disease is primarily in the muscle system, or if it stems from another part of the body, or a combination of things.
Are there specific details you focus on when taking a horse's history?
Absolutely. Several categories of information are particularly useful. Signalment, sex, breed, and age can be very important. Some muscle disorders are more common in certain breeds and can be influenced by sex and age. Management factors. Diet plays a huge role. Get the full details of what the horse eats, including any supplements, especially vitamin E and selenium. Also, consider the horse's living situation, stall or pasture, and any potential toxins they might have access to. Exercise routine. What kind of exercise? When was the last time they exercised? And have there been any changes in their routine or rider? This is particularly important in cases of rhabdomyolysis to know if exercise is a trigger. Clinical signs. What has the owner noticed? Muscle loss? Reluctance to work? Tremors? Stiffness? Photos and videos can be incredibly helpful. Onset and duration. Did the signs develop suddenly or gradually? Was there a fall, injury, competition, respiratory infection, or change in environment? Previous results. Look at past blood work. Even slight increases in muscle enzyme levels over time can be significant. Check for any prior genetic testing to avoid repeating tests. Medication history. What medications has the horse received? Did they respond to any treatments? Improvement with pain medication might suggest an orthopedic issue. Also note any recent injections or increased recumbency, which can affect muscle enzyme levels.
That sounds like a very comprehensive approach. What happens after you've gathered all this historical information?
Then comes the physical examination, and it needs to be methodical. You need a controlled environment and the right equipment.
What kind of equipment are we talking about?
A bright, focused light, an ophthalmoscope for examining the retina, forceps to test reflexes, a block to stand on for better palpation, and a standardized form for recording findings. It is important to have the capacity for photo or video recording to assist in reevaluation.
Okay, so you're all set with your tools. What are you actually looking for when you examine the horse?
You start by assessing the horse's head and limb position, behavior, and how they respond to you. Look for fine tremors in the large muscles and any unusual weight shifting. Then, while the horse is standing squarely, visually inspect and palpate their body. Evaluate their body condition score, muscle symmetry, and muscle mass. Describe any abnormalities you find.
So, you're really looking for any visual cues of muscle problems?
Exactly. We also evaluate the eyes and perform a cranial nerve assessment. Palpate the masseter and temporalis muscles in the head. Check if the horse can open its mouth easily. Observe how they eat and swallow. Check the neck for symmetry and willingness to flex.
And then you move on to the rest of the body?
Yes, palpate the limb muscles, back, and gluteal muscles. Look for any sensitivity, bands, defects, abnormal tone, or tremors. Evaluate how the horse responds to pressure along the back and croup. Assess muscle response to percussion, tapping over large muscle groups.
What about observing the horse in motion?
That's a critical part. You're looking for any gait abnormalities that might indicate paresis, weakness, or ataxia in coordination. Move the horse forward and backward, in circles, and on different surfaces if possible. You can also test their strength by doing a tail pull or pushing against their shoulders.
What if you notice lameness during the exam?
Then you need to evaluate that as well. Grade the lameness and use other diagnostics, like hoof testers or flexion tests, to try to pinpoint the source of the problem. It's important to remember if weakness or lameness is present in one limb to rule out orthopedic causes.
It sounds like there's a lot to keep in mind during this examination.
There is, and it becomes easier with practice. The key is to be systematic. Summarize your findings, noting anything that helps you narrow down the problem to a specific location or cause. Then determine if a muscle disorder is likely, and if so, whether it's the primary issue or secondary to something else. Finally, create a list of possible diagnoses and plan your next steps in consultation with the owner.
What are some examples of specific injuries and their indications?
Some examples are brachial plexus injury. The horse cannot bear weight on the affected forelimb and has rapid atrophy of the shoulder and triceps muscles. Suprascapular nerve injury. There is lateral instability of the shoulder and atrophy of the supraspinatus and infraspinatus muscles. Radial nerve injury. The horse may have a dropped elbow and be unable to advance the limb normally. Femoral nerve injury. The affected hind limb is flexed, and the horse may buckle when weight-bearing. Sciatic nerve injury. The distal hind limb is flexed, and the horse may drag its foot. Peroneal nerve injury. The hock is extended, and the distal limb is flexed with toe dragging.
What role does clinical pathology play in diagnosing muscle disorders?
Clinical pathology is incredibly valuable. It's relatively inexpensive, easy to access, and essential for detecting rhabdomyolysis. Serum chemistry can determine the presence and degree of muscle enzyme elevations. Severe rhabdomyolysis can also disrupt acid-base and hydration status. Cardiac troponin measurement is indicated when muscle disease is accompanied by cardiac symptoms.
What specific enzymes are you looking at in the blood?
Creatine kinase, CK, is the most accurate indicator of skeletal muscle necrosis. It rises quickly, peaks within hours, and returns to normal within 72 hours if the problem resolves. Aspartate transaminase, AST, also increases with muscle damage, but it can also be elevated with liver problems, so it is important to consider that.
What about urine testing?
That's important too. Severe rhabdomyolysis releases myoglobin from muscle, which can discolor the urine. Myoglobinuria is a sign of ongoing muscle damage and increases the risk of kidney damage.
This has been incredibly informative. Any last thoughts?
It's important to remember that equine muscle disorders are common and arise from a range of causes. Recognizing and differentiating them requires a careful approach. Clinical pathology is an essential part of the process.
And thank you, listeners, for tuning in to Vet Neuro Jar. We hope you found this discussion helpful. Remember, early detection and proper management are key to keeping our equine athletes healthy and performing their best. Keep those minds inspired, hearts light, and tails wagging.